Well, good evening, good afternoon, and good morning. This is Kathleen Dudley from northeastern New Mexico. And again, Robert Jardine from the Highlands in Scotland. Beautiful place. How's your weather out there?
Uh, well, good today. The skies were blue. Normally they've got big streaks of strange clouds on the top of them that sort of diffuse into like a horrible grey. But they must have run out of chemical today, so we've got a blue sky, lovely. We saw the Northern Lights going really quite spectacular last night. So that was good, I hope.
Good. You don't think it was you don't think it was all the toxic chemicals in the sky by any chance?
Well, I'm not sure. I know I do know that there's also the harp machines and that which I think they can actually make the Northern Lights appear with those too. So now I'm so skeptical I can't even enjoy the Northern Lights. How about that? Oh my Lord.
I know what you mean.
Oh God.
For
Hey.
quite some time, I didn't even go outside and look at the sky in my Box Canyon area because I was so discouraged. But I've started looking at the sky again. So
Mm.
yes, we have to claim our rights.
Mhm.
Well, this is part three of our interview with Robert Jardine on German New Medicine. And Robert, I wanted to ask if you could maybe um, go into some of the diseases that are the most, some that are very, very common. We briefly brought up the concept of prostate cancer in part two. Maybe you could start with that and explain how, along with these,
Mhm.
how the five laws of German New Medicine play out, what the conflict is, and that is an external shock to the individual, well, to the man, and why that disease situates in that organ.
Okay, yeah. Well, prostate cancer, the relay for the uterus in the women and prostate in the men is right in the center of the brainstem. So it's the
Ah,
oldest part of the brain,
ah,
um, and the right in the center of it is the relay which controls that tissue. So it shows how important that tissue must be in for our survival. Um, it's a gender or I think you call it I think a gender related conflict or a conflict of with a there's a sexual there's a few different conflicts which can trigger it in a man. One of them would be if he was being or he felt he was being dominated by a female. That would be the sort of gender type conflict we're talking about. Um, and the biological response to that, where the psyche, when the psyche steps in, is to increase the tissue within the prostate gland, which makes one of the major components of ejaculate, which helps the the process of reproduction. So it basically the body is trying to make the man more fertile, um, because obviously back in the day, back in the evolutionary day, to put the woman or get the woman pregnant would have probably stopped her giving him such a hard time. And so that's the biological one of the biological motives behind it. So what happens is the endodermal tissue starts to increase. The PSA levels go up, and um, the the gland becomes better able to produce the secretions which its purpose is. Um, Obviously, in our modern life, we can't solve the problems biologically, like I suggested earlier. So the problem, these conflicts don't get resolved, and the prostate keeps on enlarging, and um, starts to press on the urethra and stops the flow of urines, and that's when the men first start to notice that there's problems going on, that way. Another type of conflict which causes it is I've actually known this to happen, personally, not personally myself, but I've known people with this, um, would be a conflict of involving reproduction. One gentleman I know, or I knew because he died, was his daughter. His issue really was that his daughter wasn't showing any signs of wanting to have children, and she was getting to her late 30s, and um, all he knew was that he had he was diagnosed with prostate cancer. So they wanted to, they heard that I knew something that other people didn't, so they came to see me. So I discussed it with him, um, and strangely enough, because it's it's not legal to be able to claim that you can cure cancer, which I certainly do not, because nobody can cure cancer, I believe, because it's the body that cures it. The body creates it, and the body can cure it. But what that gentleman actually had to do was he had to have a family meeting, because Dr. Hamer teaches us that the best way to get resolution of conflict is actually to practically resolve, to do something practical to do that. So that gentleman had a family meeting, and in which this issue was put on the table. It was taken out of the closet, if you know what I mean, and it was talked about. And there was there was obviously a significant enough action to take to put that particular cancer or his particular cancer into what Dr. Hamer would call healing, in which he started to sweat profusely at night, because that's what happens when the tubercular bacteria become active in the healing phase of the two-phase process. So again, that's the sort of the biological purpose of that disease, is to kind of sort that emotional issue out on a biological level, by making the man more able to get the lady pregnant. Even though in our modern world, that's totally not there's not going to fix any problem, right? But the psyche, I'm afraid, it's got its own agenda. It's triggered. I like to sort of think of the psyche more of like a switch, like a light switch. If you press it on, it goes on. If you press it off, it goes off. You can't really talk to a light switch and say, do you really need to go on? Because we tend to sort of think of a psyche as like the unconscious mind, or and lots of therapists sort of, and me in the early days used to think that too. Oh, if you can talk to it, where it's not so, it's more like a switch, as I described, and you're practically switching it off by reversing what switched it on is the best way to do that. So that's the prostate cancer that you mentioned. There are others, but I don't feel too prepared to talk about the introductal cancers of that, which incidentally are healing symptoms. So a certain proportion of prostate cancers, according to German New Medicine, are actually only show when the conflict has actually gone into resolution. So they don't really need any healing. It's only the cancer which is the endodermal tissue derived or controlled from the brainstem, which, if somebody has that, they have to do something. They have to actually resolve something, or change their perspective on something, so that it goes into resolution. The other the cancer involving the ducts within that gland, the client just needs to know that they're okay, and that they don't really need any other treatment, and they don't really need to worry about it. That's the big thing, because worry is the killer. Worry makes us compliant, and it makes us weak, and it drains our energy so fast, um, and it becomes a self-fulfilling prophecy very quickly. So that would be my sort of input on prostate cancer.
Well,
Um,
thank you. And not just as it, it also makes us willing to take on these treatments that can
mhm.
kill.
Yeah. Um, yeah, exactly. It's knowledge. That is why the best time to learn Dr. Hammer's work is when you're healthy and when you're well, I mean, right now, the best time would have been 10 years ago, right? But the second best time to learn German medicine is right now. And that applies to everyone, okay? The second best time is right now. So why not opt for the second best? Because you can't go back 10 years, okay? Um, and I one thing that people really have a challenge with when they haven't eh, when they if they came to someone like me with a symptom and not having any clue about German new medicine at all is that getting their heads around thinking that something in their body is actually creating what they have firmly believed as an error or a disease. Um, and it's that shift. It's just making a shift. And sometimes that shift can't be made in the time frames that you have. And Dr. Hammer, as he says, you have to dance around the patient. So very often you don't need teaching somebody why something's happening is just confusing the issue. You 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 really just need to get that person from their perspective that they've come to me or you in to figure out what the conflict is and practically resolve it, and then help them get through the healing symptoms of that. Um, as opposed to, explaining the process to them. So that's something that is you learn with experience, I suppose. Because when I first learned German new medicine, I thought, oh God, I can just tell everyone and they'll just suddenly get better. But that didn't work.
Well, there's a learning curve with everything I find. And even though what we embrace the body is as the healing
Hmm.
system, there still is a process. Now, maybe we could take this time before going to the next one. And Robert, could you give your website
Hmm.
and other places where
Hmm.
people can reach you? And
Hmm.
I know from talking with you and reading your website that you give a half hour, no charge
Hmm.
consultation. So
Hmm.
could you maybe just give us that information so people can contact you?
Yeah. Well, I do exactly that. Any client that's interested in my philosophies on health and who's has something that they genuinely want to overcome, I offer a free half-hour consultation, which quite often drags on to a bit longer than half an hour, to be honest. Um, where I explain my processes and my philosophies, and also I learn a lot more about what the client has, and because I'm I don't want to be getting people's hopes up if I don't think that I'm have the knowledge or the facilities to help some people. Do you know what I mean? So I like to let them meet me, and also for me to meet them and to understand what they've got. And if I don't think I can help someone, I'll tell them that in that consultation. I certainly won't be taking money just for the sake of it, because it's just causes stress and makes you feel bad about yourself. It's not the way to go. So yeah, that's something I offer. I've got a website, robert-jardine.com is my website. Um, and one thing that we offer, and I must say, I recommend, if people can, it's obviously for people who live in the UK, this, but if they have a condition that they seriously want to make inroads into and make a really good go of overcoming it, they could come up and stay. We have people actually that come up and stay with us and have maybe 2 or 3 days of 2 or 3 hours a day of my time. Because to have somebody actually present is you can get a more intimate contact with what's going on in their mind and their psyche. right? And you can help them better. So that's something that we offer at our little Highland home. Um, we do actually live in quite a remote place. Actually, it's the most beautiful place that we live. Strathalladale is the go on Google Maps or something. You can find Strathalladale there, and you find our little farm on that. So that's something I offer. And what I recommend is for people to make as much use of that free learning asset, which is learninggnm.com. And I would say to people, don't be put off that if you think, oh, I'll go and read that and understand it. And quite often people think, oh my God, this is a bit above my head. You know, there's a lot of terminology that I don't understand. It's because Caroline Marcolin, who runs that site and created that website, she's created that resource for both lay people and medically trained people. So it's a website which doctors, if they so choose, could use as a reference to, and learn something from it. So go to that website, learninggnm.com. There's lots of videos that you can get for free and also ones that you can pay for. And she has done a very comprehensive translation of Dr. Hamer's work. She actually studied with him during the 90s and the 2000s when he was living in Spain. And he was giving lectures a lot. He was spending a lot of his time giving lectures. So she was one of the ladies who took that learning from him. There's also another good website, free-u-medicine.com. A guy, Bjorn Ebel, who's also done the similar thing. So if you want to, go to that website too, I advise you to do that too. But learninggnm.com definitely is the place that I recommend people to go to. Also, actually, see you're here. There's a book. That's the cover there. That the guy Bjorn Ebel wrote that book, and I think it's how many pages? I don't know. It's got about 20 pages, and it's just a very quick overview and introduction to the five biological laws. So that's that book, and I just got this recently, and I thought that's really good because there's some really good diagrams in there. There's a few brain scans in it. Uh, and there's a description of the five laws, which is a huge. It's like being given a compass when you're lost. Like disease. We can be suddenly be hit with a diagnosis. Oh my Lord, and your world falls apart, and you're just a wreck. But if you get something like this, and you can actually apply yourself, or somebody who is with you, who's interested in it, that will help you, and they can read that book and they will certainly suddenly know an awful lot more about the disease than you currently know. And there's a book written by Dr. Hamer, which is a great book as well. Yeah, I've that's the type of book you have to read a couple of three times because the more you know, the more you realize that you don't know everything.
Right.
Yeah.
I'll put the
So
links to all of those below in this
yeah.
interview.
Yeah,
And you
so
have
so
a
that
Facebook page too.
oh yes, health at Highland Alchemy. So it's health at as in AT, not the symbol, health at Highland Alchemy. That's my little Facebook. I'm not particularly computer minded or especially Facebook minded, but I put lots of little videos up. I being dyslexic myself, typing and such and isn't something I enjoy or find easy. So I make lots of videos. I take my camera out with my little device that stabilizes it, and I just talk into my phone and then put it up on the internet there. So it's there's loads of videos up there, and also on my website there's a lot of it. There's about 40 videos I think that I've made or been on shows or different things, and it's a good resource. I'm not pretending to be anything amazing with it all, but I try to get the message of what German new medicine is to people, to empower people to understand it, to take the power themselves, and I regard myself as somebody who is helps people discover the truth and uh, to heal themselves through that truth, and to go on to heal other, that once you've learned German new medicine practically and actually experienced it, you then start to incorporate it into you and your family, which is great, isn't it? It's like a organic way that information grows and becomes accepted.
It's wonderful. Okay, that was a great explanation of prostate cancer and the conflicts. Could you talk about heart? So the heart attack and perhaps also,
Hmm.
yes, is that something
Yeah,
that you're
yeah,
ready?
yeah, definitely so. And considering a heart disease is one of the biggest killers, we're told. Um, yeah, well, the heart's a muscular pump. It's not the only thing that actually pumps blood around the body, though, because if you think about it, the heart pumps blood from the heart out into the body, and then the blood diffuses into the cells, and then it kind of diffuses back into the veins and then goes back to the heart. But there's no pressure. There's no pressure whatsoever. There's no pumping pressure from the heart pushes all of the blood from the periphery of the body back to the heart. So 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 to say the heart is a pump is true, but it's also more of a regulator. Um, there's two types of heart attack. Um, there's a heart attack which is associated with the coronary artery, and the coronary artery is controlled, or the intima of the coronary artery, or the lining of the coronary artery, is controlled from the right temporal lobe in the brain. So just about round where your ear is, there is a um, a relay in the brain which controls that tissue, and it's a fear loss. It's a territorial loss conflict for a right-handed person, or a sexual conflict for a left-handed person, um, that causes the tissue. If the psyche steps in when we suffer this type of trauma, he steps in and it removes the tissue on the lining of the coronary artery. So therefore, it's actually making the diameter bigger of the artery, which in practical terms makes the artery better able to pump blood. And with an artery that's opened out in nature, it would give the man a better chance of fighting and regaining his territory. So that's the biological purpose behind it. Um, in nature, these conflicts which cause it would probably be resolved within days, weeks at most. And then the man who had suffered that territorial loss would have either regained his territory, or he would have lost the territory and never he would never be able to resolve that conflict. So he would live in conflict active for the rest of his life, which he could do, right? But in man, we suffer these conflicts, and we might get stuck in a legal process or something like that, where it drags on and on for month and month and month, maybe year on year. And then when we finally resolve the conflict, the healing phase involves the involuntary the healing phase triggers within the brain the uh, the hold on, I think it's the bradycardial heart. There's a center in the brain which controls the speed of the heart. There's actually two centers, one on the left, one on the right. One speeds it up, one slows it down. Now, with a heart attack, a coronary artery related heart attack, when that brain relay goes into healing, and the brain then tries to at a certain point of the healing process, the brain has to compress and squeeze the fluid out of the affected relay. And when the brain actually physically contorts that relay and squeezes the fluid out of it, it interferes with the heart rhythm center, and the brain the heart pumping rate reduces significantly. It can reduce down to 1 to 2 beats per minute,
Oh,
and it can
wow.
stay like that for quite some time, for days even.
Wow.
Um, and it's termed a heart attack. So that's a coronary artery related heart attack. Um, so which is an unavoidable consequence of the healing of a territorial loss conflict,
Could I
right?
interject something there? So, I was studying German New Medicine at this time, and a friend of mine lost his boat where he had been living, and it was his home, his only home. And when he found out that it had been sold, he immediately started having a series of heart attacks. And
Hmm.
based upon what I knew about German New Medicine and the swelling
Hmm.
in the brain, the only thing I had frozen in the refrigerator was a sack of meat. So
Hmm.
he actually laid down and slept that whole
Hmm.
night while that sack of meat defrosted.
Hmm.
And it took the swelling down
Hmm.
in
Yeah.
and I
Hmm.
believe saved him.
Yeah, very likely so, because death happens in the brain. The heart's just doing what the brains tell it. So a heart attack, uh, if somebody dies through a heart attack, they haven't died because the heart has stopped pumping. They've died because the pressure and the process of squeezing the fluid out in the brain has caused so much internal damage to itself that death happens in the brain first, and then the body follows. And one of the things that I have learned is that to freeze the head or to cool the head with ice packs or frozen peas or frozen meat or frozen anything makes it easier for the brain to do that process. Another thing that I also have learned is that to take a diuretic like strong coffee, um, if you know this process is happening, if you have been experiencing angina for some time, and then when you resolve the conflict, the angina stops right away.
Uh,
And as soon as that angina stops right away, um, you know that you're going to have a coronary artery related heart attack at a certain point of time, which you can calculate from the amount of time that you've had the angina. Um, so you will know that if that was going to happen, that you would definitely have a couple of very strong coffees, and probably very sweet and strong coffees, and a few ice packs just ready for for the event, to help yourself through it. Because easing the process obviously is what you want to do. Um, Whereas the other type of heart attack would be a a myocardial infarction, which is a different brain really altogether, and it's caused by overwhelm or overwhelming stress, just stress that's just pushed us past our limits altogether, and the the body has taken to actually um, adapt and change the tissue of the heart, the actual heart muscle, um, and that is again ice packs. You really want to get the swelling down in that, so I'm told. And I would suggest that's very true, that that type of heart attack is characterized by people feeling extremely exhausted. So when you start to be able to, like, you walk up one flight of stairs and you've got to stop for a rest and you think, oh my God, what's happening here? Then that's the type of symptom that you would know would be a sort of precursor to that. It's not, I don't want to worry everyone, because there's more reasons why you can be exhausted as well. Okay. So it doesn't mean to say you're going to have a heart attack, but the people that do, that's been a part of their profile. So yeah, so heart attacks, the problem isn't really anything to do with the heart. It's to do with the brain, as in every case, the brain controls the process. And yeah, like you said, that idea of the ice packs and the diuretic, because so caffeine obviously is a good diuretic. So these things can help us deal with that.
And also cayenne pepper. It tends to
Yeah.
very quickly move the blood around the
Okay.
body. And
Wow. Okay. Yeah. Yeah.
so, quarter to a half teaspoon of cayenne pepper at that moment, within a minute, it can
Wow.
open the arteries and the blood vessels, and it just
Hmm.
it has been shown to be very helpful in keeping a
Mm.
heart attack from occurring.
Oh
We have,
well, nice one.
yeah, yeah, it's a good one. Barbara O'Neill, who was I think she was in Scotland speaking on health issues just recently, and Richard Bobes was the presenter at that
Hmm.
conference, and she first introduced me to cayenne pepper. Very
All right.
amazing.
Okay.
She's
Great.
an Australian Australian naturopath who, due
Mm.
to her fine teaching, has been banned from teaching in Australia. Um,
Yeah.
but
Hmm.
we have about 6 minutes left. I wondered, do
Hmm.
you have time to go into tinnitus?
Yeah. I've actually helped a doctor overcome his tinnitus, which was quite strange because apparently it's incurable. But anyway, they don't have it anymore. Tinnitus is caused by a trauma which we hear. We hear the trauma, so it's an audible trauma. The psyche attaches the significance of what it heard, and I think also it can be what you don't hear if if it causes a trauma. But no, as I'm not terrible. Now I've said that, I'm not 100% sure about that. But definitely, what we hear can cause a trauma, um, and the psyche it selects certain frequencies of that traumatic noise, and it starts them. It creates that noise. So the tinnitus that we hear, whether it's a hissing or a ringing, though those frequencies will be selected by the psyche because it detected those frequencies within that audible trauma. So what it does, it tries to prevent you from hearing any more of those traumas. So it creates that noise. And that's its very simple biological um objective is to that the psyche thinks, well, heck, that noise was really traumatic, so let's just put this buzzing in there so you can't hear any more of it.
Mm.
And if the trauma is resolved, the tinnitus cleans up all completely, goes away. And I've seen that with um, about four different clients now that have that's been what's happened. The tinnitus just of itself heals itself because the healing is an emotional one. Healing is always an emotional healing, even though it's a practical thing you might do. It's creating resolution to something emotional because we are emotional creatures. Emotions. I suppose the psyche creates the emotions. The primordial emotions that we react to is coming from the psyche. The psyche creates them to make us respond in a way that it thinks is in our highest good. And therefore, healing is always emotional. It's always an emotional resolution to something, which is wonderful, isn't it? Because that's free. You don't need to inject it or uh, eat it. When it's there for us all through understanding the process in general, through the five biological laws of German medicine, but also understanding our lives through our own personal experience. It's there for us to have and to guide ourselves back to good health.
We don't need to lose a part. We don't need to lose a breast or a
Hmm.
testicle
Hmm.
or a hip or a
Hmm.
knee. We can remain whole, just as nature is
Yeah.
whole, and we're part of her wholeness.
Yep.
It's yes, it's a beautiful medicine.
Yep. And it's a beautiful medicine as well because it allows us to behave and to start habits, thought habits that are beneficial and to stop thought habits that are detrimental to our health. You know, self-devaluation is basically it is if anything causes us to age quicker than we should, it's self-devaluation. It accelerates everything. Uh, be- and causes many of the conditions we associate that come with age. You know, self-devaluation is quite a it's a lesson in life and one that if we start to be proactive and get good habits of thought lead to a better life. You know, you don't worry so much, you feel good about yourself and you're slowing the aging process down. I mean, that's a pretty it's a no-brainer.
Well, it is. And, I was reading a statistic about our own DNA is programmed for us to live 120 years.
I could imagine that.
So,
Yep.
if you look at the Bible and you look at how, I mean, people were living to be 200, 300, 400 years old, right?
Mm,
But
mm.
if you just look at the science, pure, the science of DNA
Yeah.
lifespan, that means we're really cutting ourselves short. And
Yep.
we can live healthily to 120. And I
Hmm.
had a good friend who lived to be 116 and a half. And except for the last 2 years of her life, she was very healthy and mentally totally, totally
Hmm.
sharp.
Yeah.
So she's a great example for me. And I figure, well, okay, I'm going to do everything that I can to live a long,
Hmm.
healthy life. So we're very
Hmm.
close to the end of this very informative interview with you, Robert. Do you have a closing statement? And
Yeah, I would say disease isn't a sentence, it's a message from our psyche. Okay. And sometimes it can be a very hard message, but uh, please treat it as a message, not as a sentence. And through Dr. Hammer's work, it's there for everyone free. Understand what is going on and why your body's doing it, and be empowered and be proactive in the process and learn from it. And that's my advice to everyone. So
fantastic.
I give it with goodwill, and I help as many people as I possibly can. But you know, you don't really need it. You know, it's all there for everyone. So don't be overwhelmed with it. It's the most beautiful piece of science that's ever been performed by on